Diabetes and heart disease and stroke. Diabetes and heart disease and stroke. Relationship? Having diabetes means that you are more likely to develop heart disease and have a greater chance of a heart attack or a stroke. People with diabetes are also more likely to have certain conditions or risk factors. They increase your risk of heart disease or stroke, such as high blood pressure or high cholesterol. So, if you have diabetes, you can protect your heart and health by managing your blood glucose, or blood sugar, as well as your blood pressure and cholesterol. In particular, if you smoke, get help to stop. Relationship between diabetes and heart disease and stroke. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. The longer you have diabetes, the higher the chances that you will develop heart disease. Meanwhile, people with diabetes tend to develop heart disease at a younger age than people without diabetes. In adults with diabetes, the most common causes of death are heart disease and stroke. Moreover, adults with diabetes are nearly twice as likely to die from heart disease or stroke as people without diabetes. However, the good news is that the steps you take to manage your diabetes also help to lower your chances of having heart disease or stroke. Risk factors increase your risk of heart disease or stroke when you have diabetes. When you have diabetes, other factors add to your chances of developing heart disease or having a stroke. Smoking. Smoking raises your risk of developing heart disease. Therefore, if you have diabetes, it is important to stop smoking because both smoking and diabetes narrow blood vessels. On the other hand, smoking also increases your chances of developing other long-term problems such as lung disease. Moreover, smoking also can damage the blood vessels in your legs and increase the risk of lower leg infections, ulcers, and amputation. Discover how to quit smoking naturally. Link in the description. High blood pressure. If you have high blood pressure, your heart must work harder to pump blood. High blood pressure can strain your heart, damage blood vessels, and increase your risk of heart attack, stroke, eye problems, and kidney problems. Abnormal cholesterol levels. Cholesterol is a type of fat produced by your liver and found in your blood. You have two kinds of cholesterol in your blood: LDL cholesterol and HDL cholesterol. Meanwhile, LDL, or bad cholesterol, can build up and clog your blood vessels. High levels of LDL cholesterol raise your risk of developing heart disease. Another type of blood fat, triglycerides, also can raise your risk of heart disease when the levels are higher than recommended by your doctor. Reference: The One Food Cholesterol Cure, 2 months free solution. Link in the description. Obesity and belly fat. Being overweight or obese can affect your ability to manage your diabetes. At the same time, it increases your risk of many health problems, including heart disease and high blood pressure. So, if you are overweight, a healthy eating plan with reduced calories often. It will help lower blood sugar levels and reduce the need for medications. Excess belly fat around your waist, even if you are not overweight, can raise your chances of developing heart disease. Even if you are a normal weight, excess belly fat can raise your risk for heart disease. You have excess belly fat if your waist measures more than 40 inches and you are a man, more than 35 inches and you are a woman. Refer to News, Weight Loss, to find you an appropriate, safe and effective way to lose weight. All in 247naturalhealthtricks.com. Family history of heart disease. A family history of heart disease may also add to your chances of developing heart disease. So, if one or more of your family members had a heart attack before age 50, to greater than you may have an even higher chance of developing heart disease. Meanwhile, you can't change whether heart disease runs in your family. But if you have diabetes, it's even more important to take steps to protect yourself from heart disease and decrease your chances of having a stroke. How to reduce risk factors of a heart attack or stroke when you have diabetes. Taking care of your diabetes is important to help you take care of your heart. So, you can lower your chances of having a heart attack or stroke by taking the following steps. greater than to control diabetes and keep your heart and blood vessels healthy, you need. Manage your diabetes, A1c, blood pressure, cholesterol, stop smoking. Knowing your diabetes will help you manage your blood glucose, blood pressure, and cholesterol. Stopping smoking when you have diabetes is also important to lower your chances for heart disease. A1c Test. The A1c test shows your average blood glucose level over the past 3 months. This is different from the blood glucose checks that you do every day. In particular, the higher your A1c number, the higher your blood glucose levels have been during the past 3 months. High levels of blood glucose can harm your heart, blood vessels, kidneys, feet, and eyes. The A1c goal for many people with diabetes is below 7%. However, some people may do better with a slightly higher A1c goal. So, ask your doctor what your goal should be. Blood pressure. Blood pressure is the force of your blood against the wall of your blood vessels. When your blood pressure gets too high, it makes your heart work too hard. Moreover, high blood pressure can cause a heart attack or stroke and damage your kidneys and eyes. The blood pressure goal for most people with diabetes is below 140/90ths of a millimeter Hg. Ask what your goal should be. More information. Simple exercises for people with high blood pressure, link in the description. Cholesterol. You have 2 kinds of cholesterol in your blood: LDL cholesterol and HDL cholesterol. Meanwhile, LDL or bad cholesterol can build up and clog your blood vessels. Too much bad cholesterol can cause a heart attack or stroke. Also, HDL or good cholesterol helps remove the bad cholesterol from your blood vessels. So, ask your doctor what your cholesterol numbers should be. If you are over 40 years of age, you may need to take medicine such as a statin to lower your cholesterol and protect your heart. Some people with very high LDL, bad cholesterol may need to take medicine at a younger age. Reference: The One Food Cholesterol Cure, 2 months free solution. Link in the description. Stop smoking. Not smoking is especially important for people with diabetes. Because both smoking and diabetes narrow blood vessels, so your heart has to work harder. In particular, if you quit smoking, blood circulation will improve. You will lower your risk for heart attack, stroke, nerve disease, kidney disease, eye disease, and amputation. Blood glucose, blood pressure, and cholesterol levels may improve. You may have an easier time being physically active. If you smoke or use other tobacco products, stop. Ask for help so you don't have to do it alone. Discover how to quit smoking naturally. Link in the description. Note: ask your doctor about your goals for A1c, blood pressure, and cholesterol, and what you can do to reach these goals. Develop or maintain healthy lifestyle habits. Developing or maintaining healthy lifestyle habits can help you manage your diabetes and prevent heart disease. Follow your healthy eating plan. Make physical activity part of your routine. Stay at or get to a healthy weight. Get enough sleep. So, develop or maintain healthy lifestyle habits. Moreover, physical activity can help you manage your diabetes and may help you cope with stress. Managing diabetes is not always easy. Feeling stressed, sad, or angry is common when you are living with diabetes. You may know what to do to stay healthy, but it can be difficult to keep your plan on track. Long-term stress can raise your blood glucose and blood pressure, but you can learn ways to lower your stress. Try deep breathing, gardening, taking a walk, doing yoga, meditating, doing a hobby, or listening to your favorite music. Take medicine to protect your heart. Medicines may be an important part of your treatment plan. Therefore, your doctor will prescribe medicine based on your specific needs. Specifically, medicine may help you meet your A1c, blood glucose, blood pressure, and cholesterol goals. Reduce your risk of blood clots, heart attack, or stroke. Treat angina, or chest pain that is often a symptom of heart disease. Angina can also be an early symptom of a heart attack. Ask your doctor whether you should take aspirin. Aspirin is not safe for everyone. So, your doctor can tell you whether taking aspirin is right for you and exactly how much to take. Statins can reduce the risk of having a heart attack or stroke in some people with diabetes. Because statins are a type of medicine often used to help people meet their cholesterol goals. However, talk to your doctor to find out if taking statins is right for you. On the other hand, talk to your doctor if you have questions about your medications. Before you start a new medicine, ask your doctor about possible side effects and how you can avoid them. If the side effects of your medicine bother you, tell your doctor. Remember, don't stop taking your medicines without checking with your doctor first. How to diagnose heart disease when you have diabetes. Specifically, based on your symptoms, your medical and family history, how likely you are to have heart disease, a physical exam, results from tests and procedures, tests used to track your diabetes, A1c, blood pressure, and cholesterol. They help your doctor decide if it is important to have other tests to check your heart health. Warning signs for heart attack and stroke. Call 911 right away if you have warning signs of a heart attack. Feeling very tired. Shortness of breath. Sweating or lightheadedness. Indigestion or nausea. Feeling sick to your stomach. Pain or discomfort in one or both of your arms or shoulders, or your back, neck, or jaw. Pain or pressure in your chest that lasts longer than a few minutes or goes away and comes back. Treatment works best when it is given right away. Warning signs can be different in different people. So, you may not have all of these symptoms. If you have angina, it's important to know how and when to seek medical treatment. Women sometimes have nausea and vomiting, feel very tired, sometimes for days, and have pain in the back, shoulders, or jaw without any chest pain. Moreover, people with diabetes-related nerve damage may not notice any chest pain. Call 911 right away if you have warning signs of a stroke, including sudden severe headache, trouble seeing out of one or both eyes, confusion, or trouble talking or understanding, dizziness, loss of balance, or trouble walking, weakness or numbness of your face, arm, or leg on one side of your body. If you have any one of these warning signs, call 911. You can help prevent permanent damage by getting to a hospital within an hour of a stroke. Note: diabetes is a dangerous disease with many complications related to the kidneys, heart, liver, and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action, and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.